Okay. In 2017, plastic surgeons in the UK published a paper, and from that paper, their findings showed that of the burns injuries admitted to emergency departments in the UK, only 3% of burns injuries were from chemical injury. But they also found that 30% of fatalities because of burns were from chemical injury. Chemical injuries don't happen very often, but the consequences are horrendous. They last with you for life. The HSA are not supposed to promote any product. However, a gentleman who was not behaving in a very safe manner was carrying on a cement plant. He was carrying a bucket, an open bucket with hydrochloric acid in it. He had no safety glasses, no protection of any description for his eyes. He tripped, fell, splashed his eyes with that hydrochloric acid. He's now blind. At 28 years of age, this guy can't see again. He has his whole life to lead. You guys, this may be your first time in college, you may have been here before, etc., etc. Some of the images I'm going to show you are not terribly attractive. They're the downside of not dealing with the chemical splash efficiently. If you have any questions at any stage, please say so. Raise your hands, whatever you want to do, just ask. Who is the person primarily responsible for my safety when I go to work? Thank you very much. Yes, it is. And likewise, when you guys go to work, when you get out of here, or even when you're in here, you're responsible for your safety. You have safety teams who help guide you. They will look at the risk assessments, etc., as Mr. Bosch and Long was saying. But it is entirely up to you. And safety has no hierarchy. No hierarchy. So if you're the youngest student here on day one in this college, and you see a lecturer, a lab technician, doing a job with their protective eyewear up here, fashionably holding their hair out of their eyes when they're doing a job with chemicals, you are perfectly entitled to say to them, oh, hold on a second here, you need to put your glasses on. Now, you do it in a polite manner. You don't go, hey, dunderhead. All right? Do it in a polite manner. But you are perfectly entitled. If you're at home and you pour boiling water over yourself, what do you do? Under the tap water. For how long? 15 minutes. Increased. But nobody's going to give out to you if you use it for 10 minutes. And at the end of that 10 minutes, or 15 minutes, Schaefer's, now you've got me. Anyway, at the end of that 15 minutes, what determines that you get checked out medically?
Whether or not you can still feel pain.
Pain, very clear indicator. You must then go get checked out. Blisters is a typical indication of first aiders. Has any of you done a first aid course? You're afraid to? Thank you. Who's that? You've held up your hand, mate. Anyway, if there's pain won't go away, if there's blisters, and if the blistered area is bigger than a €2 coin on a child, that child needs to get checked out medically. And if the blistered area is bigger than an adult's hand, in other words, my hand on me, this lady's hand on her, etc., that adult needs to get checked out medically. If you pour drain cleaner over yourself at home, drain cleaner usually contains sodium hydroxide and aggressive caustic soda, or also known as caustic soda. What do you do?
Get straight to hospital.
Water.
Who said water? For how long? Half an hour. Nobody's going to give out to you if you spend half an hour rinsing yourself with cool running water. Seriously. In first aid terms, we actually say 15 minutes, cool running water. The time you spend, somebody said to me, get to hospital or whatever, the time you spend getting to that hospital, that chemical is penetrated beyond the outer layer of your skin, your eye, and it has done more damage than you can imagine. Okay, so you start rinsing with cool running water, minimum of 15 minutes. And at the end of that 15 minutes, you always get checked out medically. It doesn't matter whether there's any redness, any lesions, any pain, any blisters, you always get checked out medically. That is because, as I said, the chemical could have penetrated beyond the outer layer of the skin of the eye. Is that okay? So we have said we treat them in the same manner. Cool running water, 15 minutes, thermal burn, cool running water, chemical injury. But there's a huge difference between them. Huge difference. How quickly are you supposed to start rinsing with water? There's a big hint up there. How quickly? Within 10 seconds. How much water do you use? Copious amounts of water. The amount of water, your safety showers, when you go off to Bosch and Lom, etc., where they have the old-fashioned system of using water, those showers are supposed to be capable of delivering 60 litres a minute for a minimum of 15 minutes. That's 900 litres of water. That's a lot of water.
So basically you get dumped on for 15 minutes straight.
Pardon me?
Basically you get dumped on with water on top of you for 15 minutes straight.
For 15 minutes straight. It's supposed to be heated and it's supposed to be drinkable quality water, which adds its problems to it. Has anybody here ever used these saline solutions for rinsing out your eyes? Why do we put salt into water to rinse out our eyes? No. No, because your eye, ordinary water is attracted to your cellular structure and gets sucked into your eye cells. So it would suck the chemical into your eye if you're trying to get rid of a chemical. Why you would use a saline solution is it's at the same osmotic pressure as your tears and it doesn't get sucked into your eye. Is that okay? Anyway, as I said, some of these images aren't terribly attractive. The downside of not dealing with a chemical splash. I make no apologies for this. This is a hand that was contaminated with hydrofluoric acid, and this is an eye that was contaminated with sodium hydroxide. That guy didn't get to see again, and I will explain that eye in a short while. There's more than 100 million molecules in the Book of Chemical Abstracts, and people like you guys, when you get out of here, are developing more molecules every year. We categorize them into a variety of different categories. The upper symbols on the top there are those for corrosives and irritants. They're the modern symbols, and any chemical you use should have those symbols on them. That gentleman was talking about housekeeping is a big issue. You really, when you're putting chemicals away, you need to mark them up correctly. There was a company not a million miles from here had an accident a couple of weeks back, and they had to use a huge amount of this stuff because a girl had put a couple of chemicals into a glass beaker. They reacted badly. The beaker blew apart and she got covered in a chemical and she had lacerations on her face. They use this stuff, which is different from water and different from saline solution, and you guys have this stuff here in the college here. And it was used, and that girl has no chemical injury, but she does have minor scarring from the glass, from the chemical. So you got to behave. You really do have to behave. I know I'm Mr. Owl fella, grumpy old fella, but you need to look after yourselves. Your eyes are the path of least resistance for a chemical to do serious damage. You must protect your eyes. And I know Mr. Bausch and Lomb produces contact lenses. You should not wear contact lenses when you're in a chemical environment, because contact lenses will hold the chemical on the surface of your eye and make it more difficult to rinse that chemical out of your eye, and the contact lens may already be chemically welded onto your eye. You do not use contact lenses in a chemical environment. Clear? Clear? Anyway, corrosives and irritants. Corrosives will destroy a large number of cells. They react violently with your tissue when they hit your tissue, destroy a large number of cells, causing irreversible damage, like the hand, like the eye. Irritants tend to cause minor damage, and it's usually only the outer layer of your skin or your eye that's destroyed, and they will regrow. They may take 4 days, 44 days, but they will regrow, provided you decontaminate. But if you don't decontaminate, the chemical could penetrate beyond the outer layer of your skin or your eye and start doing internal damage to your lungs, your liver, your kidneys, your nervous system. And you may have no sense of awareness. So in the event that you get a splash, you must decontaminate. Must be an exchange between the aggressive chemical and our tissue. This is cross-section through the eye, cross-section through the skin. It's the proteins, mineral salts, lipids, etc. That's where the chemicals are attacking. Now, if I can get these guys to work. Despite the huge numbers of chemicals there's only 6 areas where they will chemically attack your tissue. Acids will give the hydrogen ion, alkalis give the OH ion. Oxidizers and reducers remove, give electrons. Chelators will modify, absorb the calcium, magnesium in your body salts, and solvents dissolve certain components of your tissue. Mind you, by the way, and I'm not advocating you all stop, but one of the solvents that we use a lot of is alcohol. Anyway, the process from the moment the chemical hits your tissue to when it starts to do the real damage can take from as little as a few seconds to several minutes. If it is only the outer layer of your eye that's destroyed, that's not that bad because it will regrow. If it's the only outer layer of your skin that's destroyed, again, it's not ideal, but it's not that bad because the outer layer of your skin will regrow. However, if the chemical does get beyond the outer layer of your eye, do you remember that milky white cornea we had down here? That was not the white of his eye, that was the cornea. That's the clear bit in front of what were his baby blues. Do you remember that image there? Do you remember the image? Okay. There the chemical had gone beyond the outer layer and had destroyed the endothelium. As a consequence of which he didn't get to see again because the corneal graft wouldn't take, the rest of the surface of his eye was so badly damaged. Protect yourselves. You should never, there was a guy here talking about fire extinguishers. You should never have to use them. Never. If you follow your safe operating procedures, you should never have to use them. Similarly, you should never have to use this diphoterin stuff. Okay? If you follow your safe operating procedures, you shouldn't have to use it. But if you do, you need to know where it is so you can use it as quickly as possible. Anybody know the name Katie Piper? Yeah. Fabulous looking young lady. She had highly concentrated sulfuric acid thrown into her face. For a variety of reasons, there was a huge delay in her being attacked and them starting to decontaminate that girl. And she describes how in that delay period, the pain temporarily eased. The pain temporarily eased because the pain receptors in her tissue were destroyed. One of the reasons for the huge delay was because the emergency services, the fire services, when they got to the scene where Katie Piper was, they couldn't go in until the police came along and made sure the scene was safe. And one of the first things you learn as a first aider is you make sure the scene is safe. Can you go charging into a building that's on fire?
Technically, yes.
Sorry?
Technically, yes. It's just not safe.
Technically, it's not safe. Correct. He's right. He's right. It's a bit pedantic, but you're right.
No, your question was...
It's okay, yes, absolutely. Technically, you can, but you shouldn't. Okay? You're not Angelina Jolie, you're not Bruce Willis, or whoever it is nowadays. It's not Hollywood. It's more like a French movie, where things go wrong. These are these bright cells over on the left-hand side. They're live eye cells, and what you're watching is relatively weak sodium hydroxide, caustic soda, being washed across those eye cells. What do you reckon's happening to the eye cells? That's real-time video footage. Protect your eyes. You must protect your eyes. 2 acid contaminations at the top, 2 alkalis at the bottom. These are HANS, hydrochloric acid down here, sulfuric acid up here, and both are sulfuric acid. That's the downside of not dealing with the chemical splash. There are 3 things which largely influence the penetration of the chemical into your tissue and the level of damage. Type of chemical and its concentration, the temperature of the chemical, and the time of contact. The only area over which you have control in the event of a chemical accident is the time of contact. You must decontaminate as quickly as possible. With water, you're supposed to start decontaminating within 10 seconds. With saline solution, you're supposed to start decontaminating within 10 seconds. With this stuff, you have a 60-second response time. This stuff is produced by a laboratory who have been working in the area of chemical and risk and toxicology for 60 years. And they've been spending their energies and their money on this. And they have developed this product which will decontaminate both an acid and a base and a chelator and a solvent and an oxidizer and a reducer. So the 6 areas where a chemical can chemically attack your tissue, this stuff will decontaminate. But you must use it. You must start rinsing within the first 60 seconds. Is that okay? Anybody any questions? Time of contact. Let me just refer to the time of contact. One of the issues you would probably encounter is when you go out into industry, mixed environment, and somebody gets covered head to toe in a chemical, and it's a bloke, and he may have tattooed on his chest, "I voted for Donald Trump." Okay, you have no idea what you're going to see, and he may not want you to take off his clothes, but you must get the chemically soaked clothing away as quickly as possible. You must get his permission, because regardless of how good looking you might like to think you are, he may not want you to take those clothes off. All right, but it causes maceration, what they call maceration, and it speeds up the penetration of the chemical into your tissue. So you must get chemically soaked clothing away. I was talking about this a pharma company not in Cork, and one of the girls there, she was wearing her lab coat. It had elasticated cuffs. She got a splash of chemical on herself. Lab coat. She ripped it off, and it ended up with the elasticated cuff remained stuck to her skin. But she was lucky. Because it remained stuck to her skin, it didn't pull the skin away. So in the event that you are helping somebody take chemically soaked clothing away, you need to do it in a safe manner. You don't continue to rip at that clothing if you feel any physical resistance. That needs to be taken off in the controlled environment of a hospital. Is that okay? Any questions? Water is what we traditionally use, copious amount of water. Water will mechanically wash the chemical off your tissue, dilute the chemical, and you can use water on anything else. However, you're supposed to rinse for 15 minutes. It's supposed to be heated. And if you add water to highly concentrated sulfuric acid, these aren't blisters on that guy's hand. That's 2 months after he was contaminated. They're hard keloid scars. Water also has an issue where it gets pulled into your tissue. I'm not going to show, we don't have time for that video. This product, this diphoterin product, which you will see in dispensers like this, and this is to do an eye, and this is to do the skin. Very simple to use. In the event that you get a splash of a chemical into your eye, you twist the cap and you rinse the eye out. Okay? Takes a few seconds, and it stops the pain instantly. But just because the pain has stopped, doesn't mean you stop rinsing. Because you must use the entire contents of the dispenser. Is that okay? If you get a splash on your skin, take the cap off and you spray. You're not supposed to swallow this, but for demonstration purposes, I'm just doing it. Okay? You're not supposed to swallow it, but it's safe. It's a Class 2A medical device. It's safe for use on your skin, in the eyes, and in your mouth, and in your nose. If you're spraying somebody in the eye, you don't do it from right up here because it's under pressure. You do it from a distance. It has a shelf life and a batch number, and provided I use this up until and including the date of expiry, it is 100% efficient. It does the job and it's sterile. It's safe for use on open wounds. You can use this stuff. If in doubt, use it. Anyway, this laboratory set about developing something which, like water, it's a liquid and it'll mechanically wash the chemical off your tissue. Unlike water, it's an active rinsing agent. Unlike saline, it's an active rinsing agent. So it'll trap, bind, and encapsulate the aggressive part of the chemical and stop it being harmful on your tissue. It's a very, very large molecule in the presence of a base. There's an acidic site on this molecule, which by an ion sequestering system will attract the basic ion to itself, bind it, encapsulate it, and stop it being harmful or aggressive on your tissue. Similarly, in the presence of an acid, there's a basic site on the molecule which will attract the acidic ion to itself, bind it, encapsulate it, and stop it being aggressive on your tissue. Similarly, there's a site to look after oxidizers, reducers, chelators, and solvents. So the 6 areas where a chemical can chemically attack your tissue, there's an active site on this molecule which will trap, bind, and encapsulate. It also has another significant advantage in that it has this ability to go in and pull the chemical back out of your tissue. So even if you use this product after the time frame, the design time frame, it does work. It still works. This is an example of cross-section through an eye exposed to sodium hydroxide. That's the cornea has gone milky white, and down here it's remained clear. The cornea that's gone milky white was rinsed with sodium hydroxide and nothing else done to it. The one down here was rinsed with sodium hydroxide for 20 seconds, subsequently rinsed with diphoterin, and as you can see, the cornea has remained clear. This is an example from industry. This is a Hunish alumina or similar plants. It's approved under the FEC guidelines for use. The HSA are now recommending this product, though they shouldn't be mentioning the name. There's more than 2,000 substances checked out. it's been tested against. And there are a variety of different dispensers which are available. You must still get away from the danger. You get chemically soaked clothing away. Rinse as quickly as possible with diphoterin. Get medical advice. You must always get medical advice. If you've had a splash of any chemical, other than water, any chemical, you must get checked out medically. You don't stop when the pain has stopped. You must get checked out medically. You use the entire contents of the dispenser. Using this stuff doesn't cause you any harm. May cost a few quid, but you don't. But you're better off using rather than not using. This is a photograph of a lady's eye, young lady, 49 years of age. She had ammonia thrown into her eye. Her hubby discovered she was seeing somebody else, went into her workplace and threw ammonia into her eye. Her work colleagues did nothing for her. No water, no saline, no diphoterin. You shouldn't have been using that phone. Anyway, they did nothing for this lady. When she arrived in hospital, she had a grade 4 burn on the right eye and a visual acuity of 2/20. 20/20 is normal vision. Her vision was down to 2/20. Because of their experience with this stuff, they used 2 500ml eye washes. This is 1 hour after she was contaminated, and you're supposed to use this within 60 seconds. This is a photograph of her eye 6 months later. Her vision had been restored to 14/20. The only other medical intervention other than the diphoterin was vitamin C to prevent inflammation and antibiotics to prevent infection. So the product still works even if it's used after the event. This is a series of photographs of a gentleman who had sulfuric acid splashed on the side of his head. They didn't start rinsing him with water until 5 minutes later, and then they started rinsing him with diphoterin 15 minutes after that. Photograph of his eye 24 hours after the event, 72 hours after the event, and this is 29 days. When I show those photographs to medics, they go, wow. Because they expect, from the initial damage, they would expect him to have had plastic surgery. This guy needed no surgery. You should never have to use this stuff, folks. If you do, use the entire contents. Don't mess with this stuff. There are seals at the side of this. There are seals. There's a paper tab to show that you haven't been messing with it. And once you know that paper tab is there and it's within its expiry date, this will be 100% efficient. But don't mess around with it. Unless you need it for a chemical, don't use these things. It costs too much. Okay? But in the event that you have an accident, there is no amount of this stuff will cost more than the cost. The average cost in the UK at the moment for the medical cost in the UK from the NHS is a chemical incident. The average is £34,000. Okay? All right? So start rinsing as quickly as possible. Use the entire contents of the dispenser. Get chemically soaked clothing away. And always, always, always get yourself checked out medically. Anybody, any questions?
How much does that stuff cost?
Nothing.
Yeah, well, come on.
Nothing.
Yeah, well,
A shower costs, the initial cost is $11.68. That's 1,168. The refill of a shower 2 years down the road is 680 quid. Those dispensers, the eye wash dispensers, are about 25 quid a pop. That's about 35 quid a pop. But compare that to the cost of being blind. It's nothing. Anybody any questions? The cost is all you want to know about? Enjoy your college. But when you're messing around with and you're in the area of chemicals, be careful. Be careful. If you're careful, I won't make any money. All right? That's the best way to keep it going. Serious. You need to look after yourselves. And you may say it to Frank that, hey, Frank, put on your glasses. He may snap at you like I would most mornings, but you may have saved his eyesight. Is that okay, folks? Enjoy your college. Thank you.